Hello and welcome. My name is David Butler, and I am the J. Herbert Holloman Scholar of the U.S. National Academy of Engineering. On behalf of the NAE, I'd like to thank all of you for attending today's Call to Action COVID-19 event. For those of you who may not have been part of our previous events in June and August, the COVID Call to Action, in brief, was launched to facilitate multi-generational crowdsourcing and brainstorming of creative solutions to pandemic-related problems. It combines the imagination and talents of engineering students and early career engineers with insights from mid-career professionals and seasoned veterans who are NAE members. I want to extend a special thanks to the 5 teams who will be presenting today and to the expert advisory committee who have volunteered to provide them with feedback on their proposals. Dr. John Anderson, the president of the NAE, has expressed the hope that the wide-ranging interdisciplinary engineering viewpoints this initiative brings to the COVID crisis will have a tangible impact both for near-term emergency issues and as we turn to recovery and begin planning for similar situations in the future. I'm looking forward to hearing how the teams who are presenting today will meet that challenge. It's now my pleasure to introduce the moderator of this event, Dr. Alice Liu. Dr. Liu is the Assistant Director of the Office of Technology Innovation and Entrepreneurship at the University of Southern California Viterbi School of Engineering and is a part of the Innovation Node Los Angeles, a collaboration of USC, Caltech, and UCLA. Dr. Liu.
Thank you, David. I'm excited to see the teams today. This has been an unprecedented year for many of us, and it's wonderful to end on a hopeful note. I am pleased today to moderate the pitch showcase, showcasing technologies being developed to combat the COVID-19 pandemic. If you've tuned in with us before, you already know the drill. As a reminder, the format for today: each team will be giving a 5-minute pitch followed by 8 minutes of Q&A with our expert review committee, who we refer to as the ERC. The ERC, these are not judges, as this isn't a competition. Our goal here today is to help advance these ideas and accelerate their trajectory. And this includes your participation, our audience viewing from home. If you have thoughts or ways to help these teams as you're listening, we encourage you to send your comments to engcovid19@nae.edu. You can also learn more about the NAE COVID-19 Call for Engineering Action at our website at nae.edu/COVID-19. We are honored to have a very distinguished panel of reviewers on the ERC today. In total, we have 7 reviewers who have been divided across the Q&A sessions. I will introduce our ERC panelists at the start of Q&A. Now, I'd like to welcome up our first team, reusable filterless respirators. Nicholas, are you ready? You have 5 minutes.
I'm Michael Araujo from the University of Texas at Arlington, and I am presenting on behalf of UV Breathe. I'm going to be talking about a new respirator that we have developed that will help stop the spread of COVID-19 and other respiratory viruses. Next slide, please. This project was inspired by our personal friends in the medical field directly dealing with this pandemic. They are the ones that are put in the closest contact with those that have COVID-19. As we spoke to our friends, it became evident that they felt unprepared with their current solutions regarding their PPE, on the job, and with their everyday lives. Next slide, please. We have developed a prototype respirator that uses ultraviolet light to inactivate viruses without the use of an N95 filter that makes it difficult to breathe. Our focus is to supply a more permanent solution to that of a disposable N95 respirator. Next slide, please. There are currently over 15 million cases in the United States, with cases rising rapidly. Medical staff are supposed to change their mask with each patient they see, but hospital reserves are strained. Medical personnel often wear their masks for days until they are worn and fallen apart. The cost of disposable masks add up over time. We spoke to a hospital manager and found a large hospital to spend $70,000 on masks per month. Small businesses also need to keep their employees and customers safe, with the added pressure of surviving potential shutdowns. Next slide, please. During our I-Corps training, we interviewed staff at medical institutions as well as small businesses. due to their frequent and direct contact with the public. We found that confidence in surgical and N95 masks wasn't very high due to the fit of the masks. Jeff, our physician's assistant, went as far as purchasing an $80 N95 mask that provides a proper seal to the face. We also found that comfortability and breathability are big safety concerns because if the respirator isn't comfortable, the user will constantly adjust the mask, increasing risk of exposure. Next slide, please. The effects of UV irradiation on coronaviruses are well studied. UVC irradiation is absorbed by the RNA of these viruses, effectively inactivating them. Recent studies determined the dose of UV light needed for a 95% reduction of viruses. In the past, UV light was produced by mercury lamps, an unsafe and an infeasible option for PPE. Advances in technology now allow for high efficiency, safe, and affordable LEDs. Next slide, please. Our solution addresses important issues with current PPE options, predominantly N95 and surgical masks. Our respirator is designed to be easier to breathe through when compared to the N95. It uses UV LEDs coupled with our reflection chamber, which ensures that all air that passes through is sanitized, and it is designed to prevent UV exposure to the user. It has a flexible face cushion that creates a comfortable seal with the face, ensuring safety. It can be easily sanitized with a wipe or spray. It uses a rechargeable battery that provides 8 hours of continuous use and is capable of connecting to an external battery source for longer use. All these features make the UV respirator a viable, cost-saving, long-term alternative to disposable PPE. Next slide, please. Our current team consists of me, Michael Araujo, in charge of design and construction of the prototype. Dr. Wishu Zandara is the head of biomedical division here at UTARI and is focused on human factors and wearability of the respirator. Dr. Runner is a virologist at the University of Texas at Arlington and is focused on testing and confirmation of this technology. And Dr. Gans is head of the Automation Intelligence Systems Division and is team lead on this project. Next slide, please. At this time, we have finished our first prototype. We are working on a second design. We have filed a provisional patent. Our hopes are to acquire funding to complete testing of the system to ensure the efficacy of our technology and design within 4 months. What we're really seeking is additional partners for late-stage development and to move forward towards production and product launch within 1 year. Next slide, please. We would like to thank the NAE, the panel members, the moderator, as well as everyone watching for this opportunity and for attending this online presentation. Here is our contact information. Please contact us with your thoughts and comments. We would now like to answer any questions you might have for me and my team.
Thank you so much, team. At this time, I'd like to introduce our ERC panel for this round. I'll be giving a short bio, but full bios can be found on the NAE website. So for this round, we have Paul Citron, former Vice President of Technology Policy and Academic Relations at Medtronic. Dennis Disher, Robert D. Bent Professor of Chemical and Biomolecular Engineering at UPenn. John Martin, former Chairman of Gilead Sciences. Krishi Tika, Independent Director for the Pacific Basin and Ardmore Shipping. And Darlene Solomon, CTO and Senior Vice President at Agilent Technologies. Reviewers, you will have 8 minutes for Q&A. And our first question goes to Krishi.
Hello, everybody, and thank you for the presentation. Very, very interesting. I was fascinated by the technology being used, and I have a couple of questions. One is, do you have an idea of how expensive these units would be, and how long could you use the same unit?
Thank you for your question. To answer your first question, we're looking for a price range comparable to those that are already available on the market. Respirators such as the half face shields, half face mask that M3 has, 3M, sorry. So we're looking for a price range around that. Just make it affordable. And I'm sorry, your second question was
how long could you, the durability of the units?
The durability of the unit. Dr.
Yes.
Wishu Zandara, is that something that?
Yeah, the durability of the unit, I'd see it is over a year. Only part you maybe need to replace during the use is the where it's meet the face shield. So basically, we have a replaceable place seal design right now. That way, you can throw it off and put a new one if in case it damages or something like that.
Thank you. Our next question goes to Darlene.
Yes, hi everybody, and Michael, thank you, and Team One. I think this is a really terrific project that you have, and obviously the impact can be huge. A comment and a question. One additional comment is I think the sustainability and environmental impact of what you're proposing is also quite significant. It's not the main driver, but it is a very, very real consideration, and maybe another element of the benefit compared to 5 masks per hour. Apart from the cost. I love the focus on comfort. That's so important to use. The question is more around thinking about the safety side of this, how the performance compares to N95s that are used properly, let's assume. And then if there's any considerations about how you're thinking about the safety of the device itself at this stage.
So safety in regards to the UV light?
Yes.
I'm sorry. Okay. Well, thank you for your question and your comments. With regards to the safety of the UV light, the design of the respirator is designed to make sure that the light doesn't escape. So we have created redundancies in the mask itself to prevent light from either escaping out to other people or to the user itself. Did that answer your question? I'm sorry.
Yeah, I think so. And then I guess maybe just thinking about the commercial side of this and actually going forward, what you might have to do to demonstrate that would be just the next step that, to validate. Yeah. But
the validation stage. Dr. Rohner, he is going to be in charge of validation of this. So in the later stages.
Excellent. Thank you.
That's the
Our
stage
next question
that we're preparing for right now is the validation, and it's a very important thing that some other technologies are not focused on the validation and verification that it can eliminate at the level that we need to.
Fantastic. Thank you. Our next question comes from Paul.
Yeah, I think you folks have done a very, very fine job at identifying a real problem and a problem that needs to be solved. And the concept itself to me is very, very, very attractive. A couple of questions and comments. You mentioned 3M at one point. That raised the question of, have you actually approached a commercial partner that has experience in this space and has the means and wherewithal to properly get the device manufactured and validated? And so that's one question. The other one is with regard to your provisional patent. Have you used a professional patent firm that works and is competent in this space to work up the provisional, and are you poised to convert the provisional into a for real application?
Dr. Gans, would you like to take this question?
Thanks. Again, very good questions. So first of all, we've been working with the UT Arlington Office of Technology, Innovation and Commercialization on the patent application. So they have enlisted the help of patent attorneys, and they have a full office staff of professionals that work on patents. So we're working with them. The first question, we have spoken tentatively with a couple of companies, but we are absolutely interested. That's just the primary group of people that we would like to reach out to with this pitch is people in that space that can help us to bring this to production and out as quickly as possible.
Very good. Well, that's a comment for the audience out there. If anyone has ways to help this team, please email the NAE. Our next question comes from Dennis.
Yeah, it's great. Thanks for presenting and putting together really a concept here that addresses a great need. So I didn't quite understand whether any virus on the exterior of this would be inactivated. We've at least heard early on, in the pandemic, that virus accumulation on surfaces is a potential hazard. So do the external, everything from the straps to other parts that aren't exposed to the UV, are they intended to be wiped? How does one deal with the virus there, especially day after day use and accumulation, and given some of the earlier studies that said this may last for some days on a surface?
Yes, thank you for your question. So we focused on inactivating viruses on the inside of the respirator. On the outside, we hope to use sanitation wipes or a spray to sanitize the outside.
And how frequent would that be?
Well, it is recommended that we switch out our masks every day. So I would assume maybe an everyday thing.
Just once a day at the end of the day.
Oh yes.
Right.
Mm-hmm.
Okay.
Well, again, it can be done as frequently as the wearer felt that they need to do.
Yeah. Okay. Very good. Thanks.
Thank you. We have time for one last question, and that question will come from John.
For this presentation, I really enjoyed it. I think you're on this, that the unit price could be fairly high and still be cost effective, and you'll get that data. My two questions are, one about larger droplets, if there's some sort of finer, easily breathe through filter. The second is, I think people want to know if the UV light is on or not, so you have an external light to demonstrate that. Thank you.
Thank you for your question. So we have in the literature review, we did review, we did see that there were some concern with large droplets. We have been looking at more breathable materials compared to the N95. And so in some of the literature that we review, we actually found that microfiber itself is actually a lot more breathable, and it is capable of reducing up to 95% of the larger droplets. So it doesn't allow it to pass through. So in the future, we are looking at using the microfiber as, let's say, a blockage for the larger particles.
Fantastic. Thank you, reviewers. Thank you, team. If you have questions for the team or you'd like to get in touch with any of the presenting teams, please email engcovid19@nae.edu. And if you would like to learn more about the NAE COVID-19 Call for Engineering Action, please visit our website, nae.edu/COVID-19. I'd now like to introduce our next team, the Innovation Bank.
Should we start? Hello, my name is Daniel Robles. The name of our team is Co-Engineers, and the project is called the Innovation Bank. Our value proposition is to deliver the right solution to the right place at the right time. Next slide, please. We believe that many COVID problems and their solutions are structurally mismatched. On one side, COVID is a decentralized systemic peril. On the other side, our defenses are a collection of silos that often compete with each other. As practicing engineers, we need to get to the right solutions on the ground as fast as possible. From our experience, a different type of organizational structure is required to address a systemic attack. The Innovation Bank, next slide, please. The Innovation Bank works by fighting a viral agent with a viral antigen. Here we specify a decentralized platform where engineers and scientists can find each other. Game mechanics are used to reward players for producing desired outcomes. Blockchain technology is used as a giant data logger that records these transactions in time and space. So not unlike contact tracing, the connections that people make may then tell us where the problems are and where the solutions need to be. Next slide, please. Using ourselves as an example, this is our team. You don't really need to see our names or our titles or even our faces. You do need to be assured that we know how to build this innovation bank. Our secret sauce is comprised of engineers, computer programmers, attorneys, mathematicians, digital marketers, social scientists, and some other very special ingredients. Next slide, please. So who are the customers? We found that engineers and STEM professionals, regardless of their title or industry, are voracious suppliers and consumers of knowledge, information, and data. Their biggest problem is getting the right solutions to the right place at the right time. If we can remove some of the structural constraints, the typical supply and demand curve can shift to network effects where value is proportional to some multiple of the number of platform users. The Innovation Bank creates a free market that connects the suppliers and the consumers of knowledge assets in this way. Here's an example. Next slide, please. A while back, the U.S. Army Corps of Engineers had a problem. They needed to repair active leaks in a piping network below Arlington National Cemetery. A fast, permanent, no-dig solution was essential. They queried the co-engineers network and found an ideal team within hours. The referral was transparent and pre-validated by multiple witnesses. This saved thousands of dollars and weeks of RFPs and submittals. The successful team was rewarded for sharing and collaborating in an open network and not by competing or sequestering behind silos. This alone represents a fundamental shift in the way we approach systemic problems. Next slide, please. This system works because the Innovation Bank forms a self-contained economy built and shared by everyone. On the supply side, the K asset is formed when an engineer or a scientist makes a claim about the physical state of the world and another engineer or scientist validates that claim. This forms a single node with two edges. The players are permanently linked to each other and awarded a digital game token. A graph of these interactions reveals vectors that can yield valuable business intelligence. In order to access this metadata, one must either earn tokens or purchase the tokens from a public exchange at market rates. In this manner, the platform is auto-funding. Prolific claimants and strong validators could enjoy multiplier effects and become exceptionally well compensated. All players are thus motivated to provide truthful, relevant, and high-quality product. Next slide, please. So how far along is the project? Well, we started as a global engineering initiative under NAFTA in the 1990s. The work was further developed and tested in aerospace, construction, and other professional settings. In 2018, we built a proof-of-stake blockchain. We have written seminal position papers for the NSPE, the ASME, the NAIC, and we won the prestigious ASCE Grand Challenge Innovation Contest. We've delivered many keynotes and conference presentations on the topic. So our work has been featured in Engineering News Record, Digital Engineering Magazine, and Mashable Magazine, and more. Next slide, please. What do we need from NAE? We are ready to build the Production Innovation Bank for COVID-19 and beyond. The Innovation Bank could be equally suited for addressing all systemic peril, from natural disasters and social inequities to climate change and sustainable enterprise. We seek NAA validation and exposure to global industry, academies, and foundations so that we may all build the Innovation Bank together. Thank you very much. Next slide, please. Thank you. End.
Thank you so much, team. I'd like to introduce our reviewers for this round. For this round, we have John Martin, Dennis Disher, and joining us new are Sam Petrotta, who is chairman of the Petrotta Group, and Kurt Peterson. He's co-chair of the Hard Tech Group in the Silicon Valley Band of Angels. That's Silicon Valley's oldest angel investment group. So reviewers, you have 8 minutes. And our first question will go to Kurt.
So very, very interesting artificial intelligence program you have putting together there. So one of the things that I'm always concerned of with these programs that require huge databases is how you get the data. And so if you could maybe expand on that a little bit. And then the second question I have is, it's also very important, obviously, to get a tremendous amount of validation of the data. And also, how do you get validators to validate the data from the folks, from all the different companies that are applying? Thank you.
Well, initially, it's a game. So the players are basically engineers in the field like myself. We come across problems every day, and we need answers to these problems very quickly. We are looking for people who are knowledgeable, who would make a claim that I am knowledgeable in this topic, and another individual would validate that individual. Now, since you're permanently linked, it's not a frivolous union that one makes when creating a claim. And statistically, the more claims and validations one has, the more likely that they're to be true and correct. So we're basing it on that sort of statistical analysis and expansion. And so if you have an unvalidated claim, if I make a claim and somebody's not willing to validate it, that shows up in the data as a unvalidated claim, which would be tantamount to fake news or deception or something like that. Or if I were to validate the work of somebody else and I don't know them very well and they turn out to be a fraud, that could reflect poorly on me. So the game mechanics would tend to turn those situations into outliers. Did I answer your question?
I think so. It sort of sounds like it's almost like a LinkedIn kind of for businesses.
Well, we didn't actually specifically use model LinkedIn. We started this long before LinkedIn, but there are elements. We model ourselves closer to Wikipedia is what we kind of see. Instead of having articles, you're replacing articles with people, and those people are out there available to help you with your projects. Not necessarily companies, but people within companies would reflect broadly on their company. And like in the example we gave for Arlington National Cemetery, Jacobs Engineering was the beneficiary of their 2 engineers being out there with this data published.
Got it.
Great. Thank you so much, Dan. Our next question goes to Dennis.
Yeah. So again, let me just follow up on validation, because you showed a slide there, the second to last slide, I think, that pointed to the national academies. I probably missed some important details, but can you elaborate on that, on that aspect of the slide?
Well, the aspect of the slide is, so it's the presentation.
Right. You had the National Academies logo and it said validation underneath, right?
Right.
Yeah.
So we've shown that we've been validated by the NAE, the NSPE. We've done a lot of work. We got a lot of publications out there. We've won. So we're hoping that the NAE would say, yes, we are willing to, like you are doing now, as a matter of fact, it's happening right now. You are willing to present this idea forward based on the work that we've shown you we've accomplished. So it's more a system which reflects what already happens, but it's never really measured. Is happening.
So I just to be brief, I mean, the national academies, engineering, medicine, science, do write reports, right, commissioned by the government, right? That is not what you implied, but it meant by that. But those are, that's a different sort of. I don't know if I would call it validation, but at all. But there are contributions from the national academies, and that is not what you meant by that slide, I guess, right?
Well, we like to know these people. We want to find out what is your specific problem, because this is a very generalized solution. So what is your specific project problem, and how can we help, or how can you disseminate what you know to some of us engineers out in the field who are daily working with, how is this water contaminated? Is this, I need UV now, quick. So we want to be connected with the scientists more rapidly and more quickly, because we're the engineers making these things happen in the field.
May I interject about validation one moment? I'm sorry to pipe up. This is Nina. One of the things that we build in from the beginning with design is solid evidentiary foundation best practices that we already use to create reliable information streams, commercially and legally. So we're bootstrapping a new value that the Innovation Bank has sourced into well-known evidence methods for producing a new way of validating the value prop that Dan's putting forward.
Fantastic. We have time for one last question. Sam, would you like to ask a question?
Yeah, thank you. I like the idea. I assume it will be applicable to many more subjects, not just COVID-19. I want to do battery research. I want to do research on 5G. Is that true?
Well, absolutely. Wherever you have a systemic risk, where there's a cascading effects of consequence, you would need to try to, it's not just catching the virus. It's what are all the consequences. And so we're just trying to match a systemic response to a systemic problem. And there are many systemic problems, and we're hoping that this would be applicable in some way to all of them so that we can actually get to the bottom of the challenges we have in the future.
Good. I'd like to continue this conversation later on, because there are some interesting ideas here that we could help scale.
And I think your background specifically would be very useful to us.
Okay, so let's connect later on. Thank you.
Excellent. Again, if you want to reach out to any of the teams presenting today, please contact the NAE at engcovid19@nae.edu. And I'd like to introduce our next team presenting, and that is Digital News Validation Tool. Team, are you ready?
Yes, ma'am. Hello all, I am Yogesh from Team Visrupt, and our innovation is FakeVid, which is a digital news validation tool. Next slide, please. Next slide. Okay. Let's look at the problem which we are addressing. We are fond of using various social media platforms where we share most of our information and messages every day. Here is an example where James found something exciting over the internet and he immediately shares it with Macy, his close friend. Macy gets super excited after reading that message and later on tries out that remedy on herself. But the outcomes were very dangerous. She was hospitalized due to very severe side effects of that remedy. So here we saw how one fake message ruined one life, and if we imagine this scenario, it can affect many lives on a global level. Next slide. From the last year stats, there are 660 million messages which are fake and shared over WhatsApp and Facebook alone. And during this pandemic, this number will be even more bigger. So our solution deals with this problem of fake news with its prime focus on COVID. Next slide. Here is an overview of our solution. It implements two approaches to reduce fake news. It highlights the legitimate news and prevents the spread of fake news. It will be available in two formats, mobile application and web extension for business to customer section, and in the form of cloud services for business to business section. Next slide. Let's dive into the details of our solution. After getting the query result, as you can see at the center of the slide, it will also recommend related animations, videos, and textual based information to the user. So the idea here is to make user more clear about the query by providing information in these forms. For example, if you go through video-based information, there will be a real-time virtual doctor giving you more insights about your query. In this way, you will get a clear understanding of your query. Next slide. Floating action button. It is an advanced feature of our mobile application. It gives you freedom of using our application using any other application. You just need to activate Fab on your mobile and it will appear on the screen as you can see a big blue dot on the slide. Then take a screenshot and crop out that portion which you want to verify. On pressing Fab, you will get the likeliness score of your query over there. Hence, this feature will be worth in saving your time. Next slide. FakeVid has direct competitive advantage over existing fact-checking services. Here are 4 product features listed which our solution provides and are not available in any other existing solution. One of them is it uses robust deep learning algorithm. Next slide. From our past customer interviews, we have found out that in B2B section, fact checkers will be our prime customers because their work of fact checking is mostly manual and it can be automated using our solution. Then we will gradually move towards mainstream market. We have also identified some customer segments in B2C category. Content creators are one of them. Next slide. Our milestones till now are we have developed alpha prototype and UI UX interface is also ready for our alpha version. We also got many achievements. One of them is getting selected for IIC program, which is still in progress. Next slide, please. Our future plans are lined up in this way. Our aim is to complete all the targets starting from seed funding to the enhancement of features within a span of 5 months, including the release of alpha version in the starting of March. Next slide. Our team consists of 4 undergrad students of IIT Dharwad having different technical expertise, and we are being mentored by Dr. Kaylin Hames. Next slide. So to accomplish our future plans faster, we are currently looking for following requirements. Highly motivated team members are also welcome to diversify our team. We are happy to take any new ideas. Feel free to contact us either through Team Lead ID or Vizrep Outreach ID given below. Thank you for your kind attention. Now we are open for questions.
Thank you so much, Yogesh. And thank you for joining us from India, staying up late with us. For this round of Q&A, we have Kurt Peterson, Sam Petroda, Kershi Tika, and Paul Citron. And our first question is going to go to Kershi.
Hello again, and thank you for the presentation. It's certainly something that we could use, a little fact checking. Now, your product is called News Validation Tool, but if I'm in the audience or reading the news, how do I know that your product got it right? The general public is very suspicious of tech companies producing reliable information. So how will you approach in validating your validation tool and getting a buy-in from the general public?
Yes, ma'am. And that's definitely a very good question. Can you please switch over to slide number 5? Great. Yes, ma'am. So this was one of the concerns that we have already encountered by having interaction with the customers. There are some certain ways that we have that we can accomplish this. First is the fact that we can make the information about the process made available to the public. So on the Fakewood website, we can list the process flow through which the query goes to let a user kind of have a feeling of the results that are being shown are being taken from these websites, which are really reputed. The second way in which we are accomplishing it is by displaying the information there itself at the time when a user validates it. So the actual information gets have 3 kind of formats to be displayed. The textual and the image base that is written is actually the actual resource, the links. If you click on to those links, you will actually get directed to this website, which contains the full true facts about the information that you just searched. So in that way, we can accomplish this. Hope I have answered your question.
Yeah, thank you.
Thank you. Our next question goes to Kurt.
So yeah, congratulations on a very interesting, well-needed kind of program. So I want to congratulate you for using the I-Core program. I think this is a terrifically good government NIH program, which it must be NSF, but it's a great program. One of the things it requires you to do is talk to 100, I think it is, different potential customers, and I think it really gives you some good insights into how your program can really be implemented. So that's one question. But the other question, or that was just a comment. But the question I have is, this really needs to be sort of a seamless thing. When I'm reading the news on, Google News or Apple News or whatever, I just want it to be, factual. And how can you make your program in a seamless way for, I don't want to have to go and look up your program and check whether this particular aspect is factual or not. How can you make this work in a very seamless way with reading the news?
Yes, sir. That concern is actually highlighted in our slide 6. So can we go to that slide, please? Can you please go to slide 6? Okay, there we go. Okay, so let's say a user is using an application, let's say WhatsApp, and at the moment when he is reading the posts on the application itself, we have provided additional feature which is known as the FAB, or a floating action button, which you can enable or disable within our FakeVid application. So if you enable it, the floating action button will appear on the screen itself. So once you click that button, it will give you an option to crop out the remaining part and just leave the part whose validity you want to check. So right there at that point of time only, you can validate the query with the help of the FAB button that we have provided. And obviously, if you want to know more about it, you can go to the link that we have provided, which will take you to our application so that you can, it may quench the query that you want to have. So I think that can help, sir.
Thank you.
Excellent. Our next question comes from Paul.
Again, excuse me. I want to reiterate the congratulations that the other questioners have already extended to you. This is clearly very much needed. Question I have is one of, how do you establish the credibility of your system so that will you have a panel of highly regarded individuals internationally who would be able to vouch for this and say this is a useful and accurate distinction between fake news and real news? And how you deal with information that is in development where it's hard to know what's factual and what is not?
Okay, that's a great question, sir. Okay, so sir, for the first part, as far as the customer interviews that we have conducted, and as far as we have researched, we came to know that big tech giants such as Google and Facebook are searching for a solution which has the least human intervention involved in the innovation itself. So the aim here is to do most of the work through the process or the algorithm that we have developed. For the algorithm part, first of all as our database, we are taking only the reputed informations to be as an input to our dataset for the deep learning part. Then we are not just limiting ourselves to the deep learning model. We are also looking into the fields of network analysis and digital traces over the internet, as well as we are also utilizing the subjects of group psychology to understand and map the news sources to find out actually whether the news is, how much likely the news is close to being real or fake. For the second part, sir, you are absolutely right that there are some cases when it is disputable about the fact check of the news, whether it is true or not. And it can also be to the level that one expert is saying it is correct and the other one is saying it is not correct. In those cases, obviously the model won't be able to show the likeliness score and predicting the results correctly, but it will have tag down features, which is nowadays common if you see Twitter itself. So we'll mark those queries as to be disputed, or we'll have a certain tag so that the user knows that this is something which is in progress, or this is a future event, and hence it needs caution whether you are forwarding it to. Yes, sir.
Thank you. And we're just about out of time for questions. Thank you so much, reviewers, and thank you so much, team. I'd like to introduce the next team. Our next team is COVID-19 transmission reduction through saliva modifying products.
Hi, welcome.
You ready to present?
Yes. Okay, welcome. And today we're introducing the Avita Bar. What the Avita Bar is it's a chocolate that aims to make a super mask. Next slide, please. So our team is composed primarily of a bunch of fluid dynamicists at University of Central Florida. We also have expertise in business and food industry. Next slide. The problem that we're addressing is what the pandemic has done, how it has devastated a lot of industry by preventing people from combining or gathering in large settings. One of these industries is higher education. As a professor, I work with students and I see students that are struggling in the virtual learning environment. I'm working with a student now, a 3-5 student that is concerned that they're going to flunk every class this semester. So for some students, it's not, the virtual learning is just not working. On top of that, college bar crowds continue and they drive contagion that could come back to the university environment. This drives fear among students and professors and leads to a lack of willingness to go and rejoin the classroom environment. When the classrooms are not full, university loses a lot of revenue from other processes that happen on campus. This spring, we're almost guaranteed to have a third wave coming, and we need a stopgap to prevent or weaken this wave. One of the things about coronavirus is it's known to spread through respiratory droplets and aerosols, which brings us to the Avita Bar. Next slide, please. So the Avita Bar solution is a food grade based solution. We have 3 food grade products that aim to create a viscous shield. They also reduce saliva, and they also boost the taker's immunity. If you look to the right, we have experimental data of the aerosols and droplets. The bottom one shows what happens with the Avita Bar products. Bottom line, the worst case scenario we measured was about 85% fewer droplets, 95% fewer aerosols, and a functionality for 30 minutes. These are all with respect to a baseline, no mask solution. When you combine Avita Bar with the mask, we end up with what we think will be a super mask. Next slide. So in terms of early adopters, we think that the university setting is an ideal one. This setting would be driven by essentially the university handing out chocolates, going to classrooms where the professors and students take it. So the university would be our buyer. Why? We think that it will provide a safer class environment and restore the capacity and revenue streams for the university. Why this market specifically? University is often driven by science-driven solutions. And also, it's full of a bunch of students that are early adopters to a lot of technologies. So we think for that reason, I think it's a really good entry market. Next slide. Kind of future customer segments we're aiming for are commercial airlines and tourism. Being in the Orlando area, we see how tourism has devastated our community with furloughs and layoffs coming almost every month. One of the things we found about these industries is tourism is a pull for the commercial airlines, while commercial airlines is the source of the tourists. So these industries are so tightly coupled. And on top of that, both of them demand bringing people into tight corridors. So if we can, with the Avita Bar, pack airlines and pack lines again, we think we have a solution that could help both of these industries. Next slide. So where have we been? We started the concept near the beginning of the pandemic, and we went through a round of prototyping, and now we're at the point where we're engaging a co-producer, a relatively small co-producer to actually develop a product. Next slide, please. So our next 3-month timeline, what we're aiming to is have the product as far as possible timed with the peak of the COVID-19 deaths. We think we could have a pilot batch and customer feedback within this peak timeframe to generate excitement for future advancement of the product. And some of the advanced kind of concepts we want to explore are formal FDA approval. We don't need FDA approval to get to market, but we do for a medical claim. And then after that, we want to figure out how to get this to different industries or different customer segments. One thing I think I need to mention is, although we're timing this with the COVID-19 pandemic, the product applies in the future with recurring COVID-19 cases, flu, cold, and potentially in other industries to improve the sanitary environment. Next slide, please. So these are our asks we have for the NAE. We want expertise in food manufacturing. We lack experience in regulation. We think that's important to implement into response systems. We also need access to co-producers, and how do we scale this up into to bigger or to more markets? And lastly, investors. Next slide, please. So this is our Avita solution. If you have any questions, we'll try to handle them. And there's my contact information, and feel free to ask for a sample, and I'll try to get it into you.
Thank you, Michael. Chocolate to stop COVID. Reviewers, are you ready for this round? We have for this round, Darlene, Kurt, Paul, Dennis, and John. And our first question goes to Dennis.
Yeah, that's great. This is a brilliant idea. I live by cough drops, especially during the winter, and my understanding is there's a specific molecular pathway that's triggered by cough drops, and maybe you or colleagues can chime in on that. But I guess I wonder, from conservation of mass idea of the virus, that consumption of such a edible would affect viral distribution within the person consuming it. Would it go down into the esophagus or spread throughout the mouth as well, and affect the infected person?
With that, we have not evaluated the potential impact of the infected person. We're taking the approach of evaluating directly reduction of droplets and aerosols. But that is a great point, and it's something to consider.
Is there precedent for what I just asked, that if you as I say, a cough drop, does that change the distribution from nasal to oral to digestive tract? Any sort of virus or microbe, bacterial or otherwise, do you know?
Not that I know of. Kareem, do you want to maybe comment on the cough drop? David?
Yes. Yeah. So on that note, it shouldn't have an impact on a person that is infected, especially that we do have ingredients that actually help the immune system, as Mike noted. In terms of the cough drop, we have evidence that if you actually have a cough drop and you're actually infected, it generates more saliva and increases your transmissibility level. So that was a finding, and what we discovered.
Is that published? Yeah.
It's in process of doing so.
Very good.
Submitted.
Fantastic. Thank you. Our next question goes to Darlene.
Yes, thank you. I thought this was one of the most innovative approaches I've heard in all of the ways to let people take more ownership for safety. I have a question around the durability of 30 minutes was actually, I thought, quite good if that's when it kind of falls off as compared to, I don't know what the trajectory looks like over that 30 minutes. And I guess along that, my question is around how much is known at this point or understood about the mechanism and being able to predict what molecular species are going to be most effective as you take this forward, or maybe how much of that went into the design of what you're using today? That's the question. And just a comment is on the commercialization front, it seems like there's probably a lot that you could leverage from the whole nutraceutical industry.
Thank you. Those are excellent points and questions. I think in terms of the molecular mechanisms, we're fluid dynamicists, and we're hitting it from, what's the viscosity of your saliva and how that relates to breakup mechanisms. So we've not actually avoided, or we have not actually addressed the molecular aspect of this.
But based on that, you can really predict in many ways, before actually, testing. I think it sounds like you have very good models for knowing what kinds of, materials for foods will be most effective.
Oh yeah. That is definitely the case. And the way you mix the materials really drives how the product behaves.
And any comments on the 30 minutes? What does the activity level look like through that period?
It is, so the saliva reducer works for about 30 minutes and the viscosity shield works for about 15 minutes. So we have this kind of like competing effect that works together. And the reality is this drives the probability of transmission down. It's not a fail safe, but much like a mask, it works to reduce probability.
Super, thank you, and great work.
Fantastic. Our next question comes from Kurt.
So I see startups, every day. That's kind of my business, and this is kind of one of the most innovative startup ideas I've seen in a long time. Very, very interesting. So one of the problems with one of the potential problems with these kind of products is individuals vary, quite a bit from person to person. How dry your mouth is, how much saliva you generate. Could you talk a little bit about what happens, in the population, the distribution of the population, how one particular Avita bar affects, different parts of the population with different saliva production amounts?
So from that end, our N is on the order of, 15. It's not huge, but we see that, just from our general observations, some people actually have so it's kind of cool because the two ingredients of the viscous enhancer and the saliva reducer is the one that varies between person and person. It could actually stimulate a burn sensation that leads to more saliva, at least initially. And that's why this viscous, it's kind of nice that the viscous shield is most productive at the very start when that potentially comes out, if that makes sense. But
Okay.
I think you have a fair point. More data is definitely needed in terms of more people and different populations and so forth.
Thank you.
Our last question comes from John.
Thank you. It's great that you have data that supports that hypothesis of statistical reduction of transmission. I think that's very strong. And I believe you answered this question, the use on air travel. When you're on the plane, there's good filtration. I think you're proposing it when people crowd to get on the plane and get off.
Yeah, I think maybe even potentially both, because it's not just a technical problem, it's also a perception problem, right? Mm-hmm. And if you know that the airline's doing stuff, it's hard to tell, hey, the air cabin replaces the air every 20 times an hour, right? You could tell people that, but they don't know what that means. But if they are actively doing something and forcing people to actively do something, I think the general crowd, the flyers, will feel a little safer.
Thank you.
Excellent.
Oh, you're right.
Oh, go ahead.
The TSA line is another obvious point. The plane, like the deplaning and loading, and the 30-minute duration works pretty well with all those.
Thank you so much, team, and thank you so much, reviewers. Great questions, great comments. I'd like to now introduce our final team for today, and that is Health Documentation Solution for the World's Most Vulnerable. Team, are you ready to present?
Yes, we are. All right, hi, my name is Jordan and I'm presenting on behalf of Frontida Records. Next slide. So there are currently 18 million displaced people around the world who have escaped into hundreds of refugee camps. At the start of 2020, 13,000 of them lived at Camp Moria in Greece, which is actually Europe's largest camp. A few members of our team actually visited Camp Moria back in March, where they met Najim and his family. Next slide. They're one of the hundreds of refugee families who called Camp Moria home. However, in September 2020, this home was destroyed. Next slide. Camp Moria was set on fire and Najim and his family had to escape to a new camp. Najim's wife, Shumela, who was pregnant at the time, actually suffered a miscarriage during the traumatic transition. And all of their possessions and their medical records were burned. Next slide. Because of the way that medical records were documented in the camp, Shumela's medical history will be completely unknown to any new doctors, hurting her treatment. And along with thousands of other refugees at Moria, her medical information was recorded on paper, which was destroyed in the fire. Next slide. Because of the uncertain and volatile nature of refugee camp conditions, current health documentation methods are simply unreliable. And if clinicians can't access reliable records, they'll misdiagnose problems or misprescribe treatments. And this poses a serious threat to refugees like Najim and his family. Next slide. And then on top of that, at the administrative level, bad record keeping means poor decision making. Resources are hard to allocate, there's no aggregate data to analyze, and it's generally really hard to track diseases and coordinate between different NGOs on the ground. Next slide. And although the EHR market is booming, most systems simply aren't made for use in under-resourced areas. Current systems are hard to use, they may not be legal, and they lack the modularity to respond to the ever-changing needs of the camps. Next slide. So Frontida was founded in collaboration with health actors on the ground to fit these pain points exactly. So we're creating a series of integrated health modules which are designed to put the power to adapt in the hands of those with the most at stake. Next slide. So we're really proud to say that we've already implemented 2 systems at the new camp in Greece, an electronic health record system for the miners clinic and a triage system for the camp's central triage center. Next slide. And these systems have already served a combined total of over 1,300 refugees. We've triaged over 500 patients and clinicians have scheduled over 1,700 visits. Next slide. We're also constantly collecting feedback from our partners on the ground and modifying the systems to fit their most pressing needs. We've already made over 9 iterations in just the last 7 weeks. Next slide. So for clinicians and NGOs on the ground, Frontida's system allows them to operate more efficiently and effectively. We managed to save clinicians over 14 hours in our first month of being implemented. And since they now have access to reliable records, the quality of their treatment has also improved significantly. Next slide. And then for administrators, Frontida allows them to monitor the activity of various healthcare actors and aggregate data trends so that they can maximize their effectiveness and make more informed decisions for the camp. And then just to illustrate just how impactful our system has been in less than 2 months of being implemented, here's a little bit of feedback from some of our partners on the ground. Next slide. The director of the new camp says that Frontida is already helping to move people out of the camp. Next slide. Field coordinators say that our system is helping medical NGOs to secure funding. Next slide. And clinicians have verified that we're making their work much, much easier. Next slide. So as a team, we put in more than 4,000 hours of work, but we're not stopping anytime soon. We're constantly looking ahead and planning our next moves. Next slide. So this winter, we'll be onboarding 9 NGOs at the new camp in Lesbos. We're building out a pharmacy system, and we're also transitioning to a no-code infrastructure so that we can respond to our customers' needs more quickly. Next slide. And then in the spring, we're hoping to launch our EHR in clinics in Jordan through the Children of War Foundation, an organization that helps children in war-torn areas. In these clinics, we'll also be documenting information for cutting-edge medical solutions. Next slide. And right now, we're actually in the process of negotiating a partnership with a low-orbit satellite internet provider, which would allow us to implement our systems anywhere in the world, no matter the infrastructure barrier. And then we plan on leveraging this technology in the fall to serve Floating Doctors, which is a nonprofit that provides healthcare to remote parts of Panama. Next slide. So in addition to COWF and Floating Doctors, we've been contacted by over 15 different organizations across the world. Next slide. And by implementing with our 3 main customers in Greece, Jordan, and Panama, next year, we hope to impact more than 35,000 lives. Next slide. But in order to scale and maximize our impact, we need a sustainable business model. Right now, we're piloting our products in Greece for free. However, once the pilot period is done in February, we plan on licensing our different modules to our partners so that we can cover our costs and use the difference to scale. So we're currently working on our pricing and our business model so that we can expand as quickly as possible, but we greatly appreciate any guidance we can get. Next slide. So Frontida needs your help connecting to mentors with expertise in nonprofit growth and sustainability. And we're also looking for donors who share our vision of implementing healthcare solutions in underserved and volatile environments. Next slide. On behalf of our team, I'd like to thank you for listening, and now I'd like to open up the floor for any questions.
Fantastic work, team. Again, to the audience, if you have questions or you'd like to get in contact with this team, please contact the NAE at engcovid19@nae.edu. I'd now like to introduce our reviewers for this round. We have Darlene Solomon, Kurt Peterson, Sam Petroda, and John Martin. And our first question goes to Kurt.
Congratulations, team, on a really much needed and very impactful product. And it's also especially impressive that actually you've already launched it and demonstrated it. So that's really fantastic. One of the things I'm concerned, two questions I have. One is about intellectual property. This is basically just an app. I don't want to say just an app. I don't really mean that, but it's an app, and people could reproduce it pretty easily. So if you could comment on that, and also what exactly is the preferred mode of the preferred instrument that people use, a computer or an iPad or an iPhone, and just some comments about that. Thank you.
Yeah, thank you for the question. And I think Laura will be able to speak to this.
Yeah, so in terms of intellectual property, one of the big things that we're working with is the data itself. So once a company or a nonprofit starts working with us and sees the value of our solution in terms of the data, they could, in theory, switch to another provider. But our big value prop here is actually our adaptability and our modularity, because it's expensive to hire a company to change the app on your own or hire an engineer yourself to change the app. So in terms of the intellectual property that we have itself, yes, we have these different tools, but we also have a company backing it that can affordably modify these tools for the different providers and react to the different situations. And so someone could try to come in and build an app like this, like we are doing, but getting into these places and showing trust is a huge barrier to entry. And so that's something that we're focusing on and we're doing a really good job on, that you couldn't just replace us because of all of the political things going on in refugee camps.
And the iPhone or iPad or computer, which is the kind of the preferred embodiment?
Yeah, so generally tablets. You could use it on a computer or on a phone too. It's flexible in terms of being a mobile app or being a web app.
Got it. Thanks.
Great. Next question goes to John.
I think you've done all the right things in terms of being on the ground and having local stakeholders and already completing demonstration. So you're really on a good track for where you are. There are other examples, of course, and the most prominent example you may want to relate as something that you could aspire to. Egypt has a national identity card, and they created a database, and they had the highest prevalence of hepatitis C. And by taking a nationwide approach and really doing the data the way you're doing, they were able to virtually eliminate the disease over the last decade. So there's precedent, and the trust you're developing and the ability to generate data already bodes very well for your future. Thank you.
Thank you so much. It's extremely encouraging.
We have a question coming from Paul Citron.
Yeah, thanks for inviting me into this review group. I just want to say, and maybe I shouldn't, but you really touched a nerve with me. I happen to have been born in a displaced persons camp, And in trying to reconstruct my family's experiences and documents and what have you later in life, not having good records is a real problem in a whole bunch of ways. But, when you're a non-citizen and you have to start documenting where you've been and whatnot, this kind of a tool can help people integrate into their new homes. And that's not a trivial thing. So I'll stop there.
Thank you for that
thank
comment,
you so much
Paul.
for that. Yeah, thank you so much, Paul. We definitely, in creating this idea, we definitely emphasize the idea of refugee ownership of their record. And it's extremely empowering because, these refugees at these places, one thing that our team learned when visiting the camps is that lots of the times they don't have much permanently, but if we can, just give them their records and they can have access to that wherever they go, then that's like a huge thing for them. And it's something that can, protect them and save lives potentially. And yeah.
Wonderful. We have one more question from Darlene.
Yeah, I would just really want to start with congratulating the team, and the success that you've had in engaging in these camps is incredible. And in many ways, having done 3, it just comes to think about how can you scale this? How can you take it to the next level? Because there's so much benefit. And I'm wondering if you feel you've gotten sufficient connectivity into some of the larger global funders and non-for-profits and so forth at this stage, or maybe where that stands, because it just seems what you've accomplished is so significant and has so much more potential.
So we actually, I wouldn't say that we've tapped into the biggest, funding pools for us to scale, which is something that we're working on right now. And one of the reasons why we're doing we're happy to be here and connect with you all. But we are making the right moves, the right political moves rather, to get established in these areas. For example, we're very well networked in Greece so that we can operate in refugee camps there and navigate the political situation there. And we're always open to making new connections. But if anyone would like to help us or has any resources that you think would be of use to us, we greatly appreciate that.
Wonderful. We're so glad you're here today, team. Thank you so much, reviewers. Thank you so much, team, for presenting. This concludes the pitch showcase portion of our program today. Please join me in congratulating each of these teams on rising to the challenge and for their creative solutions to combat the pandemic. These teams are an inspiration. I'd now like to invite the chair of the Expert Review Committee, Paul Citron, to share some remarks on the presentations today.
Thank you, Alice. And you did, again, a great job in moderating today's pitch round. So thank you. And the teams did a superb job. I mean, it was a pleasure to listen to their pitches. When the NAE issued its COVID-19 call to action earlier this year, we knew the pandemic would be highly disruptive, but its full scope and impact on our lives was still unclear. Now, as 2020 is coming to a close, the pandemic still rages and intensifies in many regions. We have learned many things about managing a novel, robust, and highly contagious virus, one that can produce severe symptoms in many patients and exhibits high lethality. As the experts predicted, COVID-19 is not just another flu. Engineers have and are playing a critical role in the quest to mitigate and contain this disease. Here are some examples. Last spring, ventilators were in critically short supply, potentially depriving patients access to this life-saving technology. Today in the United States, ventilators are in abundant supply and on standby when needed. Critical care personnel continue to be overworked. Here again, engineers have sprung into action to make patient care, especially critical care monitoring and integration of bedside information, more efficient. Remote monitoring strategies have been developed that permit more patients to be under surveillance and reduce some of the work overload of intensive care staff. Sophisticated data and analytical tools are being harnessed to rapidly identify treatment protocols that produce meaningful improvements to patient outcomes. Bioengineers are among those at the forefront of vaccine development. They're playing critical roles in the complex process of bringing effective vaccines from the laboratory to the public as quickly as possible with high levels of confidence regarding safety and effectiveness. This is a Herculean task that goes well beyond the creation of the vaccine itself and includes novel high-scale production processes, analytical tools, data management, innovative storage and distribution strategies, and meticulous collection and analysis of follow-up data. Engineers and their colleagues have helped reduce the vaccine development process time from years to months. Safe and effective vaccines are our way out of this crisis. The idea pitches we heard today, as well as the two previous rounds, serve as additional examples of engineering innovations that have the potential to reduce the burdens of this pandemic. Today's pitches offer innovations that cleverly address some of the many improvement opportunities that exist. For instance, there is a much better understanding of how this virus propagates. Respiratory droplets and aerosols from infected individuals remain suspended in the air for extended periods of time and serve as a vector for transmission. Protective masking, social distancing, and simple hygiene measures can mitigate spread. As we just heard, there are other novel strategies like modifying saliva properties that reduce droplet suspension time in air. Highly effective face masks are relatively expensive and are still in short supply. Creative strategies have been developed to improve availability as well as effectiveness. The concept of a reusable self-sterilizing mask that safely uses UV light sterilization could address the availability problem as well as improve the effectiveness of masks in many settings. Mass population migration is still a reality, unfortunately. In many parts of the world, incoming refugees are processed using paper-based documentation systems. These are cumbersome, fragile, disorganized, and difficult to access. The negative public health aspects of a fragile documentation system poses a risk both to the refugee and society at large. Easy to deploy electronic record-keeping field modules offer a solution to paper-based approaches. The internet has democratized communications and information distribution. Unfortunately, misinformation, either innocent or sinister, is a large part of the accessible offerings. The creation of objective analytical software approaches that vet the reliability and relevance of posted information is a challenge, but of vital importance for public health as well as other societal aspects. Fake information is dangerous in many ways. Enabled by computer networks, an interesting new method to more comprehensively capture existing knowledge, wherever it may reside, and help turn knowledge into innovations was presented. This approach may accelerate the innovation process and elevate their utility. I'd like to thank the pitch teams for responding to the NAE's call to action. It is important to note that although the imminent introduction of vaccines provides hope that the pandemic crisis may soon be behind us, the innovations presented in the pitches may be applied to other unmet needs today. They will live on. And for the students who have participated in the pitches, I believe they have acquired practical skill sets and experiences that will make them better engineers and innovators. Alice has given you some information on how to contact the NAE if you have any inputs that you would like to provide. So please do that at engcovid19@nae.edu. And finally, I'd like to extend my thanks to the Expert Review Committee for their insights, Alice again for making this a very smooth process, and to Brandon Green and other NAE staff members behind the scenes who have helped put this event together. I'd like to extend our best wishes to everyone in this program for the holiday season. Stay healthy. And I guess David Butler is up next.
Thank you, Dr. Citron. On behalf of the National Academy of Engineering, I'd like to thank everyone for their participation in the pitch event today. The teams have presented some very exciting and provocative ideas for dealing with the COVID crisis, and I think we're all eager to see how they develop. We greatly appreciate the hard work they've put into their proposals, and we're sure that the insights and advice offered by the members of the Expert Advisory Committee will help guide them as they continue forward. Dr. Liu did an excellent job moderating the discussions, and we thank her for hosting today. I'd like to close with some additional words from NAE President John Anderson, who said that the pitch events are fun to watch and inspiring, but that, quote, the greatest product of this initiative might be the intergenerational learning occurring in both directions between young and experienced engineers, end quote. I've learned a lot from these presentations. I hope you have too, and I greatly hope that you've been motivated to identify your own difficult problems to tackle and to seek out your own diverse team to bring both fresh perspectives and wisdom to bear in finding solutions. Thank you. We wish you all a safe and healthy holiday season.